think the doctors just cringed when Shing said we don't have to see the doctors. No, I think it's certainly complementary. And if you think about population health management, which is, whether it's the government or some delivery system trying to manage the health of the entire population, there's not enough resources to track and monitor every individual, every citizen. So we need to leverage technology to identify the high-risk patients, the patients who are trending in the wrong direction, the patients who are exhibiting symptoms which may be cause for alarm. And if you can identify these patients through a series of screenings, leveraging technology, you can then decide how to intervene. So whether it's go see a medical professional, go see a specialist, or do something around behavior. So at the heart of BioPay, which is known as Nusa Health in Indonesia, is the idea that we can help patients become healthier, live healthier, understand their clinical data so that they can be accountable for their own health. And at the same time, all that data that we collect, we can leverage at the country level, at the provider level, to be able to identify predictive algorithms to identify segments that are at risk. Then you can go after those segments with the limited resources that you have. So I'm in total agreement. As far as the UGM partnership, I'm pleased to say that we've been working closely since earlier this year. And together we've actually identified and reinforced the feature set within Nusa Health. So it's very much tailored for Indonesia itself. We've got, it's localized, so it's in Bahasa Indonesia. But more importantly, it's also influenced, designed, and we've got contribution from the UGM team directly. So it's been a true partnership. We launched in private beta a few weeks ago, and I'm happy to also announce that over this past weekend, Nusa Health is available on the public Google Play Store. So feel free to download it, and you can start to track aspects of your own health. The iOS version won't be available until the end of the year, but that is coming. So if you've got Apple products, just hang tight till the end of the year.
Thank you, Cliff. Specifically with Nusa Health, this is probably one of the most innovative initiatives in digital technology production in Indonesia, because it is a pioneer of combining higher education and business sector, specifically here, international company like BioPay, which is part of SIXCAP, and Mr. Patrick Trang here, the chairman, is here, and the local partner is Suryo Bisulisto. In Indonesia, this is one of the most innovative initiatives of linkage between higher education and industry. And it is in a sector that is futuristic and also a sector that will be growing immensely in Indonesia. And from that experience, we have two professors from Gadjah Mada, but first from the School of Medicine, Dr. Lutfan Lazwardi, and then from the head of the academic hospital in the University of Gadjah Mada, Professor Dr. Herini. Maybe you can comment that experience in itself, working together with the BioPay team, the that created Nusa Health, an Indonesian-made preventive healthcare digitalization solution. Could you share that experience and how you see that could be the solution for healthcare in Indonesia in the future?
Yeah, thank you very much, Pak Josh. Well, I think it's a very great initiative that we collaborate together, although it's still in the early stage, but I think, yeah, based on our experience in the health sector, working in the health sector, and collaborate also with the friends from the health office and from the hospital from different provinces and districts in Indonesia, actually we see the great potentials to use the technology. I personally think that right now the use of the IT is still, yeah, somehow left behind if we compare with other sectors. But we see that we need to do something. It's not just business as usual to, how to say, to improve the status, the health status of the community, but we should do something better before. And yeah, based on our experience, I think it's very challenging that the health sectors with the different situations across Indonesia see the potential use of the technology. And this is, I think, also a very good initiative that, although now it's still in the early stage, but usually a lot of people see that it is, challenge and also probably something which is can be seen also as the initiative to try to make the health situations in the different way that it might be also very useful to improve the status in the health of the community. And I think it's well, probably we will see the impact in the next futures, but I think it's a very good initiative to start as early as possible.
And this pioneering experience, which can be a model or a benchmark in Indonesia of how technology companies come into Indonesia, working with Indonesian institutions to provide an Indonesian solution. A lot of the testing is conducted at the academic hospital of Gadjah Mada University. And with us here, we have the director of the academic hospital. And I'd like you to share how this experience is from a learning curve experience in terms of the university and also the hospital, the academic hospital, and how you see it will be received in the so-called market.
Thank you, Pak Judge. I'm from the UGM hospital, and like Pak Judge and Dr. Lufan mentioned about the Nusa Health in Indonesia and BioPay in Singapore. During we have the collaboration with SIXCAP, with Pak Cliff and others, we have this is new for us, and we think if the program is very challenged, like for the preventive for the patient, we have many patients with chronic disease or infection, because in UGM hospital we have many patients like that. However, our hospital is the new hospital, about 4 years old, and until now we have the collaboration also with BPJS, and then many patients use the BPJS in our hospital. And we think if Nusa Health is very challenged, and also we have think if the useful for our patient, because many patients in Jakarta on in Indonesia usually difficult to have the information as soon as possible. If we use the Nusa Health, and then we can see if we perform a laboratory, and then we can see the result of the laboratory, and then from this, from the Nusa Health up, and then we can the patient see what is they should perform after that. Maybe like discussion and consultation with the doctor, and where they fix go to the doctor, and then make the we have make the head impact in the our patient is increase, and then many patient and in the population more care with their health. Yeah, I think that all.
So, I'd like to go back to Dr. Andre. Such an initiative, how would you see the prospect in terms of the health market itself, and what would you see as the challenges?
So thank you, Pak George. So the main issue in the healthcare industry is asymmetric information, because the doctor has more, not the patient. That's why with this assisted living technology, we call it Nusa Health, we can make some kind of equal level of information. By this time, for example, the government or the insurance, they spend a lot of money in chronic disease and also some terminal state disease, kind of like cancer. And these curative things is very expensive. And then it's not to prolong the life. Yeah, maybe just for several months or just a year, but then the quality of life is reduced. So it's very costly. So one, we have asymmetric information. Second, we have the costly healthcare services. And if you mention about the technology, is it possible to improve or to be a solution of these issues? For several articles, they have mentioned that the relation between the health services and technology is really close. Though they don't have robust evidence about this, but then from other sectors, it's already proven. So, for this kind of context, like the country of Indonesia, we should implement this kind of technology to help the people to be the center of the services, as the other speaker mentioned before, and then to help them to having kind of dashboard for their own health status, and also as a media to be very interactive with the physician, the family physician in the primary level, or the specialist physician in the secondary and tertiary level, and also with the hospital, because we can manage their health status all together. So in the near future, actually, the asymmetric information can be solved with this kind of technology. But then the challenge, though some said that 50% of Indonesian people are really familiar with mobile technology and also really fluent to use the social media. But this health application is not just an apps. We need to encourage them to manage their healthy lifestyle. And to date, we have evaluated that the health promotion program, the classic one, is not really working. So we need something new to improve the behavior of the people. And we don't have a kind of roadmap or established strategy to implement this and to measure the impact. But we should start and we should try. And by the end of 2018, so we start with 2019, I think the universal coverage is one of the big issue. It is currently it is just a health system issue, but then in 2019 it will be a political issue. So we have to see this as our milestone. So we can think deeper and deeper, and we can find a good solution how to implement this and make it familiar to the people. Thank you, Pak George.